when I look in the mirror, I feel like I don't see what I feel like inside.
Well, Richard is just the perfect candidate. He is in his 60s, who's been very happy with his appearance for a long time. He's a confident, funny, and interesting person. Basically, his main frustrations had been that, you know, his grandkids kept jiggling his loose skin underneath his neck.
My granddaughters have decided this is a toy. And so, short of slapping their little hands as they're doing that, I asked him about it, and he said that for best results, to do the neck lift and to also do the lower face to get rid of the jowl line and stuff.
So in analyzing him, he also had a lot of hollowness in his mid-face area, and he had a significant amount of expression lines around his eyes. So a plan essentially was created for him to address his neck with a lower face and neck lift, to add volume to his mid-face area with fat grafting, and to address the expression lines with Botox, because that's what works the best for expression lines around the eyes and forehead.
One of the things that impressed me right off the bat was Dr. Zizadeh that I have not heard from other plastic surgeons. And I haven't seen a lot, but over the 10 years I've been saving this money, I go to 1 or 2 a year, and he takes a very different approach towards men than he does women.
When we approach men, it's almost a completely different process, at least the way I think about it. Men overall, I think, don't want to look done. They don't want to look like they've ever had surgery. Now, in women, sometimes if they're overpulled, which we never want to have overpulled look, but I think they can get away with it a little bit better than men can. Because men, once they've undergone this radical transformation, it's just very hard for them to really recuperate. So it is very different. We think of them very differently. We do different procedures, and we address, again, their particular needs and complement other procedures to make it a balanced approach.
I'm vain enough to do this, I guess, because I am doing it. But again, I'm not trying to recapture my youth, and I don't want to look different. I just don't want to look tired.
So during Richard's surgery, number one, we went and proceeded with harvesting some fat from his abdomen to inject into his mid-face area. We call that a multi-level fat grafting. It's a little modification of what other fat grafting techniques are, because we don't sit down and process it aggressively. We want live fat cells, so we very gently process it. There's a theory that within this serum, there are some stem cells, adipocyte stem cells, that help the fat cells survive. Number two is where it's injected. The locations are very important, and the most common areas are the mid-face area and the pre-jowl area, which is an area right there. That's where we lose a lot of facial volume. So for Richard, we focused our injections into those regions. So we injected under the skin, above the muscle, within the muscles, and below the muscles, multi-levels, to create better blood supply for the fat that's transplanted. The other major aspect of the operation was the lower face and neck lift. We made very critical incisions where it would not be visible, but yet control the facial hair. So those incisions were all on very important creases, nice creases that, you know, once you actually see Richard a few weeks after surgery, they're essentially invisible. And we also made some incisions underneath the neck to take some of the excess fat that's there and to tighten some of the muscles that were loose. So in combination with moving excess skin, tightening the underlying muscle layer, and removing and recontouring the neck, we're able to get a fantastic result.
He promised me in the beginning that he doesn't believe in overdoing. His goal is just to make you look rested, not necessarily younger, but rested, and just take away some of the signs of aging. With that alone, I couldn't be happier. And the response I get from people that know me that can't figure out why I look different, to me it's good. Because it's better than them saying, oh, you had surgery, did you? But they can't figure it out, and then I have to explain it to them, and they go, really? And they start looking for evidence and they can't find evidence. So to me, that's perfect results.
When I saw Richard in our postoperative evaluation about a month after his surgery, I mean, it was an unbelievable appearance in a sense. He looked great, he looked natural, he was happy, I was happy. Those things are very, very important. And that's the goal. That's why I love what I do. That's what I want. I want to be happy, I want the patient to be happy, and I want the results to look great for the patient. So he was ecstatic. I think we achieved everything we wanted. We got a nice improvement in his neck. He still looks like Richard. He doesn't look overdone. Nothing stands out, and that's the key thing. He just looks natural, he looks good, and he's as confident as ever.
I think that the thing I feel the most is I feel a little bit more confident. Not that I felt bad, because Dr. Zizadeh said from the very beginning, I had the right attitude for doing this. I felt fine about myself on the inside. I didn't feel like my face was matching the way I felt about myself. And now I feel like I do. I don't feel like I'm walking around with this, you know, Brad Pitt face or anything like that at all. I just feel very comfortable with the way I look.